Hi, everybody. Good evening. Welcome to Evoke Therapy Programs broadcast. I'm Dr. Brad Reedy. Today's March 8th, 2022. So tonight's presentation or broadcast is about psychological testing, as is always the case when we pick a specific topic like this that might be applicable to a small percentage of our audience. I'll do my best to apply it to principles that would be helpful for everybody, even if you don't have a child that you're looking at testing or somebody that you love that you're looking at testing with. So, but one thing that will help me is those that are in attendance live. If you have any questions that you want to see me address, I'm happy to do my best to respond to those. I first of all, I want us to think about testing as part of a larger circle. I think we think of testing as the way to get diagnosis and assessment. Now, I'm going to talk about some of its strengths as I go along tonight, but it shouldn't be taken out of context. And context means the situation that the person being tested is in, their age, if they've been tested before, what's the stress level that they're under at the current time? Are they going through something difficult? What are the observations from others in their immediate vicinity, the therapist, the staff, if they're at home, the family, the parents, the therapist that might be seeing them. And so when we think about testing, it's one way to close the loop, and it does some things that natural observation, just a therapist looking and talking to somebody, can't do or can't do nearly as well. So we add to the objective and the projective testing our natural observations, what we're seeing. We don't just give all the testing all of the weight of our assessment and our diagnoses, but we lean on it for certain things. Objective measures are things like multiple choice, right? Where there's an answer in the test booklet where you can choose between answers, true or false or multiple choice. Projective testing are things where you can give any kind of answer, where you're asked to look at a drawing and to describe the story of the drawing, or you're asked to look at an ink blot and describe the first thing that you see in the ink blot. Those don't have choices. So whatever comes out of the person, we think about it as projection. It's purely coming from inside of them. All tests, psychological tests, are normed against clinical and non-clinical populations. So in other words, one of the benefits of testing, and this is something that's misunderstood sometimes by the general public and critics of testing, is that you don't need a control group in some ways, because the control group is in the development of the test itself. It's been tested on people who aren't demonstrating clinical levels of certain diagnoses or symptoms. So that's what you're measuring it against. It generalizes well, and it's something that you can take the test results and extrapolate. So when you get a written test, 25 pages or so, when you get a written test, it's not that every single thing in the test that they're describing, the narrative of the testing report, was identified in the testing. They're identifying certain characteristics or clusters or traits of human behavior, human processing, and they're saying people with these kinds of traits demonstrate these kinds of behaviors or these kinds of patterns in their life. And so that can be helpful, because the most important thing when I think about testing and the families that have used testing in my career is that parents or loved ones are overwhelmed by the negative bent of the testing. And I said this the other night when I was introducing this topic, that I'd be speaking on this topic. It's really important for me to say this and for you to hear this. Psychological testing essentially is problem focused. While there might be some small mention of strengths, psychological testing isn't designed to identify those as much. And the focus of the report is going to be in the areas where there's a weakness, where there's a wound, where there's a scar, a mark, a difficulty. It helps to identify and differentiate subtleties between diagnoses. So we can talk about depression and anxiety, but it can help parse out and identify and describe the smaller features of the diagnostic categories. It's accepted across programs and treatment facilities and therapeutic approaches. So it's a shared language that we therapists have. When I get testing, the first thing I do is I go to the diagnostic categories and I read the diagnoses. Then I go to the educational testing and I look for strengths and weaknesses and for splits. Because what the shorthand is telling me is it's telling me again about a pattern of behaviors. I've talked about this in other broadcasts, and if you want to find out more generally about diagnosis and pattern and trauma and kind of the decision tree, the way that the flow chart, the way we think about things, you can look at those. In fact, Malia, you can pull that up where it talks about diagnoses and patterns. But I'll say it to you in short here. Essentially, symptoms are a way of coping with distress. Distress being the largest umbrella that I can use to describe trauma or wounding or difficult circumstances, adverse circumstances in somebody's life. So what happens is if you are harmed, if you are hurt, how you cope with that hurt, what's your preferred way of coping? And to make it really simple, some people prefer drinking as a way of coping. Some people dissociate, meaning that they disconnect from their feelings. Some people get very anxious and try to control everything around them so as to prevent further injury. Some people can shut down and feel so overwhelmed by it. Some people will rebel. And so your preferred style of coping, which is a combination of your genetic traits, right? Some of those you're born with, but also the patterns and the style in your family, that will become a pattern of behavior, which over time, neurologically speaking, and speaking in clinical terms, that pattern will become set. And when a pattern is set, it is predictable, and we call that pattern of symptoms, that pattern of coping, that pattern of dealing with stress, we call that a diagnosis. Like I described earlier, testing sees things that the natural eye, no matter how qualified the therapist is, can't see. Sometimes the way that somebody processes, how they think, how they interpret information, how, do they learn well and remember things well that are given to them orally? Can they read the written word and remember it and respond to questions about it? How quick are they? Are they easily distractible? So we start to see the way that somebody processes. And in therapy, unless it's very severe and very consistent, the therapist might not be able to identify how somebody processes, what their working memory is versus their long-term memory. IQ and learning is a part of that thing that you can see, especially in our program in wilderness therapy. The reason why IQ and academic testing can be so important is because we are a primary care program, meaning that we take people with higher clinical needs. And so academics in school become very secondary in our milieu. While there's some school, we are a registered school with the North American schools. We can issue credit. We have teachers, PE, English, psychology, and science. While we can do that, we're not. That's not the thrust of our work. That's not the big emphasis in our work. And so, one of the most common, in fact, the most common identifying complaint that parents give about their children prior to sending them to Evoke is school problems, which makes sense because school is the easiest, most universal measure of whether or not somebody's struggling or doing well. If we were talking about young adults or older adults, we'd be talking about work relationships or social relationships more. So we see how somebody thinks, how they processes, what kind of learning styles, differences, and deficits they have. Like I said, some subtle underlying differentiating diagnoses can be teased apart in the testing. Sometimes you're looking to rule in and rule out certain diagnoses. You want to say, is what we're seeing here anxiety or ADHD, for example, among the many options that you could be given. And the testing can start to differentiate that because sometimes those can look very similar. Sometimes PTSD can look like all or any of the diagnoses. So you're starting to draw things with a finer line, with a finer, with the finer brushstrokes, if you will. One of the questions that I get most often is, should my child be tested? And my answer is, if you have the resources to do it, I think it could be helpful for anybody. Now that the therapist will specifically guide you and advise you on when your child should be tested and if they think they should be tested. But I will tell you this, in my career, I've rarely seen it do anything but help to give clarity. And even the child themselves. We use the information very judiciously. We don't necessarily hand over the 25 pages to them. We kind of go over the highlights and talk about the things that are most important for them to be aware of. For example, if they have a learning difference, if they have a learning deficit, we want them to be able to see what it is, because first of all, there can be accommodations that are made by school and learning facilities, but also they need to know that different learning styles can be benefited from knowing what they are and knowing what your weaknesses are and finding ways to advocate for special needs, for special assistance. So if you can get your child tested, I think it's great. How you use it after that will be um, helped by your therapist. I have psychological testing from when I was 16. One of the greatest fears that people have is that diagnosis is going to follow my child around with them their entire life. I can tell you from personal experience, that's not what it did for me. It's something that is a snapshot at a moment in time that I could reflect back on and understand in the context of that time in my life. When I thought that a child was, when we think a child is tends to over identify with problems and diagnoses, when they're kind of we call it identity foreclosure, when they just accept what is given to them. They allow somebody else to define them. We're going to be much more careful with how much information that we're going to give them. Again, we're going to talk about peaks and valleys in the testing, strengths and weaknesses, rather than absolutes. What to be ready for. When they should be tested, I didn't have this question on this first part here, but we want them to settle into the wilderness therapy program. So typically we're not going to do it in the first 3 or 4 weeks unless the child is demonstrating an average or better than average level of stability. We're going to wait until the stress and the anxiety of the program has something they become accustomed to living in. I'll talk about how it's done so that you can also see, the day of. We send out the objective test out to the field. The ones that have multiple choice, true, false, those go out to the field, and the client or the student will work on those in study time ideally prior to the psychologist's visit. If there's something left over, then they can work on it a day or two after, and we'll make all the time that is needed. It's very important that you complete your paperwork. The paperwork, the interviews, the written interviews from the parents must be completed for the psychologist to synthesize all the information and file the report. It's important for you to know, like I said, kind of the overarching theme, that the psychologist will consult with the evoked therapist to get input and let that figure into the equation. Oftentimes when a psychologist was looking for a differential diagnosis, right? They were walking on that line. They would call me and say, I'm seeing a little bit of this and I'm a little bit of that. What are you seeing? So they'll do additional consults even after the testing. So the interview with the child, the self-report from the child, again, it's stated very matter-of-factly. So the psychologist will write, child reports this, or Stevie or Joni, or I don't know why I picked those two names. Sue or John are identifying this. They're complaining about this. The therapist and the psychologist don't necessarily take everything everything doesn't get equal weight. There is an art to this science. This is the part that the students love, is they get to sit in the car with the psychologist and a staff member present for supervision purposes. but they'll usually get snacks that they enjoy, bagels and cream cheese, something like that. Some snack that they'll enjoy. They'll be out of the weather. They'll be in the comfort of a air conditioned or a heated car. So at least during the testing, we're trying to make them as comfortable as possible, so they have access to the parts of their brain, to the higher level thinking parts of their brain. It usually lasts about 3 to 5 hours out in the wilderness. So that's aside from the objective multiple choice tests and questions that they're doing before and afterwards. The cost has ranged in the years. The cost can range between $2,500 would be a low end to $5,500. It's something that's increased quite a bit in the past 15 years or so. So again, when I talk about is it worth it, it can always be helpful. It can always add color and texture and specificity to what the therapist is thinking. But there are sometimes with families where they're asking me, and I'll say, this is not something that is an absolute necessity in this case. I think I can see pretty clearly what's going on with your child, and they haven't struggled in academic settings except for, when substance abuse or depression or anxiety or school refusal started to come up. Then we saw the struggles. Then we would say that might not be necessary, especially with the cost involved. About 1 week after all paperwork is completed and scored, you'll have the results to go over, and then the psychologist will set up a phone call with you. If you can stand it, and most parents can't stand it, listen to the psychologist first. They will most often send you the testing. Some do it right before talking to you, so you don't have time to get into the weeds of the testing. Because like I said, it's problem focused. It looks and identifies every aspect of pathology that it's looking for. And then it identifies characteristics, traits, behaviors, prognoses based on those diagnoses. Make sure that you come as an informed consumer. Ask all the questions that you want to. Write them down ahead of time, and allow the psychologist to alleviate some of your concerns. I will tell you this: if you're listening, and if you've done this, you know that what I'm saying is you probably had the same experience, but almost universally, parents were pretty felt pretty defeated after psychological testing results because of its focus on the negative, on the problems. Part of the technically speaking, the testing isn't really meant for laypersons to read. So it's really about a kind of shorthand amongst therapists and programs. And then, listen to the recommendations based on it. Again, they're doing testing, they're getting results, they're plugging that into a diagnosis, and then with that diagnosis come the recommendations, the prognosis for treatment. I'm not going to go over everything here, but there are several testing instruments that are used. Like I said, the clinical interview is an important part of it. I talked about the Rorschach test, ink blot test, a projective measure, the Minnesota Multiphasic Personality Inventory, or the MMPI, and the Milan Adolescent Clinical Inventory, or the MACI. Those are kind of the gold standard of objective tests in the country. And then there are a host of intelligence and academic testing. There's testing for depression, there's testing for substance abuse, and there's testing for more personality traits and flavors. Like I said, expect it to be problem focused. Expect it to be more extreme than what you're used to. If all of us were tested, the average clinical psychologist would pick out, even if we didn't reach clinical levels, they would mention, by the way, that we didn't reach clinical levels, meaning people that are in therapy or in need of therapy. That's a clinical level. Somebody who's diagnosed with a clinical level of depression means that those scores are consistent with people that are getting treated for depression, medically and psychologically, treatment-wise. But if all of us were tested and we were below clinical levels in every area, which would be not completely remarkable, but I wouldn't be surprised that in some areas we would peak and go into that clinical level. Um, it would still then take those highest peaks and it would describe people that are that peak in those areas. If you score high in depression measures, even if it's below, it's a subclinical level, it's going to then go on to talk about people that struggle with depression, for example. So that's to give you a flavor of how overwhelming it can be. It's gonna talk about problems. It's gonna feel extreme. Um, it's a like I said, it's something that when you get in your therapist, you look at and you quickly start to get a picture of this person before you've even met them. Can somebody be retested? Typically, they want to have a couple or a few years in between testing. You're looking for developmental stages. Testing a 14-year-old who's struggling with school and substance abuse disorder, and that same person at 16 who's struggling with the same issues might not yield anything new. But talking about somebody testing at 9 and somebody tested at 14, you're talking about different developmental stages, and I imagine many different behaviors. So it's a gray area, but you want sometimes some development to occur for you to get any value out of the retesting. There are times when somebody reads something that is especially painful or scary to them, that they want changed in the testing, and that's not always something that the therapist or the psychologist is going to be willing to do. If it's new information that they didn't have and they want to figure that into the equation, that can change it. But if you just don't like it, or if you're afraid that other people are going to read too much into it, the psychologist, by virtue of their training and their licensure and their commitment to ethics, won't change anything. The testing is what it is. And I suppose that's one of the risks. If you're looking at therapeutic schools or programs and they know that your child has been testing, they're going to require the testing before entry. If you don't give it to them, they're going to assume that you're trying to hide something. And again, when we read it as professionals, it doesn't sound to our ears and look to our eyes like it looks to the parent. We don't think about it in as darker terms as a parent would. And so that answers the question, will the testing haunt them or follow them and have a negative impact on their future? That's just a hard one. In my experience, it's all based on the ego strength of the individual. If somebody is more susceptible to suggestion, to having their identity defined, and there are some adolescents, young adults, and adults that gravitate toward that style of incorporating information, then I would pause and consider the testing and or telling them about the testing until they grow up and mature a little bit. But I will say that, as this is true of a lot of things in the questions we get, as people get healthier, they don't do those things. Identity foreclosure, susceptibility to suggestion or labels isn't as threatening to them or to their progress into their identity. So again, that's something you're going to have to weigh in and out. I lean toward it not being a negative, but there are definitely personality types and specific people that I've worked with where I kept a limited amount of information back from them. I don't know that in terms of my recommendations for testing, that I've ever recommended that somebody not get tested because I was afraid that they would over-identify with it and that it would haunt them. If things are that serious, one of the things I said to my son, I remember this when he was in wilderness therapy when he was a young teenager, and I was learning new things about him. I didn't share all the very private details, but some of the major behaviors, substance abuse specifically, I did share with the parents of his immediate friend group. And one of the pieces of feedback I've gotten over the years is, weren't you worried about his reputation? And my response was, well, he wasn't. He was kind of proud of his reputation. And I think it's important for parents to have, if my son is abusing substances, or daughter or child is abusing substances, I think it's within your rights to know that as a parent, so that you can make decisions accordingly. I remember this story. I'll tell this story. This relates again more generally to things. I one time many years ago was flipping through the channels of TV, and came upon this documentary on secondary concussion syndrome in athletics, specifically in high school athletics. And there was one horribly tragic and disturbing story and scene where a young man who had recently had a concussion, nobody knew about it, and he lied about his symptoms, played football, and then during a fairly routine football play, his head was concussed again, and he collapsed on the field. His family was taking a home video of it at the time, so it's on film, and he collapsed on the field and never recovered and passed away. Very, very sad story. And as I was listening to the story and listening to how, that's why there's so much concussion protocols in sports now, and they can get baselines, and they can, without your consent, they can tell if you have a concussion or not, and they'll take you out of the field until the symptoms have disappeared. And I remember as they went through this young man's story, he was a star football player, linebacker on the football team. Some of his close friends knew about some of his symptoms, but he lied to the coaching staff and to his parents. And he lied for the reason that everybody would understand and know, which is he knew that if he told the truth, that he would be kept out of the game, and he didn't want to be kept out of the game. So when clients tell me that certain facts of their background, certain choices that they make, even certain diagnoses might limit some of their opportunities, part of my response is that means that the system is a healthy system. If the system takes into account, meaning the school, the program, the therapist, the parents, the community, if it takes into account the diagnoses, the behaviors of the child, and responds accordingly, yes, some of it could be punishing. Yes, if that young man had told his coach and his parents about his headaches and his blurry vision, he might still be alive today. But he would have been kept out of the football game, which, by the way, he would have thought of as a punishment. So just to give some perspective about this, it is as protective of the individual as it is limiting. And if somebody is diagnosed, for example, with a learning disability that's going to affect, for example, the way that they take tests, there can be accommodations made for the rest of their life, all the way through a doctoral degree, about the kind of time and resources they get when testing. So in that way, it can be just as helpful. Of course, the psychologists and you will send the testing only to the schools and professionals that need to see it, and that are in the final phase of acceptance. Insurance companies find out about it too, if you submit it for insurance or if it's on the record. And so in that respect, again, if you have a mental health diagnosis, might that prevent you, for example, from getting a license to own a gun? The fact of the matter is it might. And that process of limiting somebody's access to a gun makes sense with certain diagnoses because of the risk of suicide or hurting somebody else. So while it might feel limiting and punishing, you might not be able to get into the military or other things like that. There might be limitations. We believe that those limitations are based on good science. So the added value for me is almost always outweighs the risk, but you have to know that some of the risks that I've mentioned today do exist. Children over-identifying with it, limiting themselves, some people reacting emotionally to it, certain contexts reacting to it on its face value. in kind of a knee-jerk way. It's really important that not just that we, which we try to do our very best job with, try to incorporate it into a larger whole, but that you incorporate it into a larger whole, and that you take it somewhat with a grain of salt. It's a reference point at one given point in time. I don't know if I still have my psych testing. I might have it somewhere in a file somewhere. I love to look back on it, and it actually makes me feel connected to that angry 16, 17-year-old kid that I was at the time of testing. And it gives me compassion and empathy for what he was going for. It's somewhat objective. There are, like I said, because it's used and tested over tens and hundreds of thousands of people, you can get a level of severity scale. A clinic, crosses a clinical threshold. And it's also using every resource that's available to you to help your child and help them going forward. So it's a shorter broadcast than normal unless you have a lot of questions. But that's essentially what we think of when we think of testing. And I hope, especially for those of you who are considering it, it helps you. And for those of you who might be in the process or getting testing, take a breath, set it down, listen to the psychologist, read it with a grain of salt, read it knowing that it's going to emphasize problems and pathology. All right, questions. When you're talking about testing, you seem to be using psych testing versus neuropsych testing as one. When would you recommend one over the other? I typically would include neuropsych testing. Again, it's going to be a little bit more expensive, but I don't differentiate between the two. When I'm thinking of psychological testing, I'm thinking of neuropsych testing also. Make sure, again, you interview the folks that are doing it, and they are legitimately neuropsych testing and not just saying that they're doing that. So ask questions. The referral that you get from your consultant and or from Evoke will help identify and tease those things out. Neuropsych testing just emphasizes neurological functioning, executive functioning, the thought process. It just adds more of the neurology and the way that somebody thinks about information, the way that somebody learns information, the way that somebody expresses information, the way that somebody can take information in. So it just emphasizes that more. Is the psychologist that conducts the evaluation an Evoke therapist or from the outside? At the current time, we haven't had for many years and do not have any Evoke employees who do testing. We have some that do testing, but nobody performs it for Evoke. It's somebody from the outside. I like, if the child is in treatment, somebody asks, what are the pros and cons of doing testing while at Evoke versus after? I like doing it at Evoke. The benefit is this word is always strange when I say it. It's a sterile environment. It's not physiologically, medically sterile, right? It's dirty out there, but it's sterile because they're not distracted. Their nervous system has had some time to relax because we've waited for that. They're clean from substances. That's a really important factor. They're not using substances. So in that sense, the outside world and the pressures of the world are minimized or mitigated somewhat. And so I prefer, as long as they've stabilized in the program, I recommend that you do it during the program versus afterwards. Besides the fact that doing it during will help shape the last stages of treatment at Evoke and what the next step are. Even if the step is, in either case, for example, if the child is coming home, the kind of therapist, the kind of therapy, or maybe there's some outpatient services or specific niches that you want to ask for. For example, if your child has borderline personality features, for example, just one of the many, having them enroll with or see as somebody who practices dialectical behavioral therapy. If somebody's struggling with depression, somebody who has a cognitive behavioral lens can be helpful, for example. So it's going to give you information about the next step, next level of care, next approach. Well, again, this is a very specific one. I don't know, for those of you who might not be in the program. Well, actually, I'll open it up to any questions that aren't related to psych testing. Let me go over the upcoming announcements. Then if you have any live questions that don't relate to testing, I'm happy to take those. As you know, my books, The Journey of the Heroic Parent and The Audacity to Be You, are available on Amazon and on Audible. I read the Audacity to Be You, the second one, and I just finished this week with the editor the final manuscript for the third book that's being presented to the publisher tomorrow, likely. So I'll keep you updated on that as we go along with that. We have online support groups for current and alumni families. So if you are a current alumni, remember you can attend of our wellness program. Any of you can attend our wellness therapy support groups. The next one is March 10th. So that's in a couple of days at 6:30 p.m. Mountain Time. And then we have one a month that's for alumni only of our wilderness program. That's March 22nd. And then if you're an intensive alumni, April 12th is the next one for that. Contact me, Leah, at evoketherapy.com for more information. If you want to do a deep dive into your own work, the next available in-person Finding You workshop. This is a 4.5-day experiential small group psychodrama. I can't think of something better but to help accelerate or introduce you to therapy if you're new to it, but accelerate your therapy. It's a deep dive into your family of origin, your history, your past, and how that's affecting your current relationships and challenges today. April 20th through 24th. Like I've said many times, we pay for our management staff, our therapists, our partners. Everybody in my family that's an adult has been to one. I've been to several myself. It's something that's a part of my self-care, my self-improvement practice. April 20th to 24th is the next one. And we also have an online version, March 25th through 27th. So it's a shorter version. And it's if time and money are a factor, we did this for the pandemic, and I'm really impressed with. I was after the first one, really impressed with how much can happen during the online version. And then if you've been to a Finding You, we have a Returning to You program. The next Returning to You will be May 11th through 15th. Contact intensives at evoketherapy.com for more information. If you want a therapeutic coach for parenting, for anything that's going on in your life, to do your own work, we have attachment-based therapists and coaches that do coaching for Evoke. So just contact coaching at evoketherapy.com. They can help you virtually. That's one of the great things about the pandemic. I'm so grateful for this, that people have become more comfortable with virtual therapy. In fact, I haven't been back to I still see my therapist every week. I haven't been back to her in person since the pandemic has somewhat eased up. I don't know if I'll ever go back, actually. I had 20 years of in-person therapy with her now, and now I'm happy doing virtual. Much more convenient for my schedule. We have pursuits trips. These are adventure trips that go anywhere from 3 days to 30 days, customized for families or young adults. Think recalibrating, reconnecting to your work. If it's a family, it's about having fun with some very light therapeutic support. We ask all current parents to attend, just to try it, 6 12-step support groups. Any combination of Al-Anon, CODA, Families Anonymous, or AdultChildren.org. Also, RefugeRecovery.org or NAMI.org, which stands for the National Alliance on Mental Illness, have classes and resources in your local community. All of these broadcasts are available on your favorite podcast app and Spotify. Just search Finding You and Evoke Therapy Podcast or go to SoundCloud.com. You can find Evoke Therapy Programs or me, Brad Reedy, on Twitter and Instagram using the handles at Evoke Therapy or at Dr. Brad Reedy. You can also find the Intensives program on Instagram using the handle at Evoke Therapy Intensives. And on Facebook, you can find us by searching Evoke Therapy Programs or Evoke Therapy Intensives. And then we have a blog that Malia, who moderates for us, does a wonderful job of curating and supporting. So we have new blog articles each week, new content each week. My next broadcast will be a live Q&A. If you have family and friends or siblings of a child, they're welcome to attend. March 16th at 6:30 p.m. Mountain Time will be a Q&A for Evoke parents, family, and friends. Happy to do that. If any other questions have come in, Malia, I'm happy to take them. Would testing point to medication? Yes, it can help. Not absolutely. A psychiatrist has to make that determination his or herself with somebody who has prescribing, which psychologists don't have, prescribing rights. But absolutely it helps to inform that. No doubt about it. ADD and mood-related medication, for sure, can be helpful for that. So if medication is something that might be in the picture, and that you're really have some questions about adding testing to that overall picture, can help give you some security. Somebody writes, our son was tested when younger and was convinced he had ADHD, which was not diagnosed in prior testing. And we did a testing just prior to him coming to Evoke. Do you think it is not as accurate as it could have been if we just waited for him to be at Evoke? Just curious. I don't know. I suppose I want to be very clear. And since I'm being recorded, we can always look back at this. I don't know is the first answer. But the second answer is I would lean toward having it done at Evoke. Because again, like I said, the outside distractions are more significant in the outside world. Evoke is kind of a pared down version of the world. It's a smaller universe, and focus, both mental focus and emotional focus can be sharper in the Willis. It's not absolute. Like I said, we want to make sure that they are stabilized at Evoke. When I've had a child that takes longer to stabilize, we've had to push testing back. And in a couple of cases, many years ago, even to the point where it happened after Evoke. But in general, somewhere in week 5 or so, 5 or 6 is about the sweet spot for most kids. And I would prefer it to be in treatment at Evoke. Somebody writes, regarding your books, is there a website we can buy the books on where some money is used towards scholarships for the kids to attend Evoke? Great that you should ask. In fact, Malia, if you can put up the link there, there is an Evoke Family Foundation. And if you go to Amazon, part of their Amazon Smiles program, Malia's posting it there. Folks can purchase the books through Amazon Smile and designate Evoke Family Foundation as the beneficiary. A small percentage of the proceeds goes to help people, to help the Evoke Family Foundation, which funds, among other things, everything related to supporting families and children. There's virtually no administrative costs in terms of when you think about a charity organization. There's virtually no overhead to the Evoke Family Foundation. So a very high percentage, nearly all of it, goes to help children and families at Evoke. Absolutely. Oh, difference between a psych testing, neuropsych testing, and a psychiatric evaluation? Well, a psychiatric evaluation is usually just the interview with the psychiatrist. It's usually 15 minutes to a half an hour at the longest. And it's just a series of questions where the psychiatrist, it's not as scientific. I want to be clear. Psychiatric, to be evaluated psychiatrically, you can add the testing. Like I said, you can add the testing to it. But psychiatrically, it's mostly a very short interview with the psychiatrist where they're they're asking about specific symptoms. And then they're going to consult with family, parents if the child is a minor, and ask follow-up questions. They're going to ask the therapist, and they're going to ask for medications that have been successful. If other people in the family have been treated for similar presentations like depression or anxiety, and one of the parents or the siblings or an uncle or an aunt or grandparent is on a medication that they found effective, they're likely going to do that. There's also some new information. In fact, I'm going to have him on one of these at some point. Somebody I just heard present at a conference where they can do a metabolic test, which will increase the effectiveness of prescribing medication by a significant percentage. Historically, we've done that by just asking if other people in the family have tried the medication. That's been kind of the way that we've done our metabolic testing in the past. But now, because of the science that we have now and the ability to map genes in a person, we can look at specific genetic markers, and specifically the ones that are the medication that's most effective at treating people who have those markers. I think that's it. Somebody asked, what is a walkabout at Evoke? A walkabout at Evoke there's two kinds. There's a walkabout where a child, an adolescent, is taken out of the group and they go with 2 staff. It can be, and they spend 2, 3, 4, 5, 7 days. It can be a privilege. It can be a specific clinical assignment or focus. It can be if they're struggling in the group context. So it can range quite a ways on the continuum. A family walkabout is something a little bit different. That's something extra. If you want to come out, I'm not talking about a family visit, which every family can do. Come out and spend a day in the field or a day and a night in the field. Every family can do that when the therapist at Evoke says it's the right time. But if you want to do a multi-day experience with your child, that's something a little bit extra. Where again, 2 staff members can take the child and the family out for several days and do some backpacking and hiking and camping and really focus on the family structure. So if you have the time, if you have the resources, that's not part of the regular program, that family version that I described. You can do a little bit of extra work with your child. I performed them a couple of times in my career. We've been doing them since the beginning. And it's something that you can request and talk to your therapist about. All right, folks. I hope that was helpful. Even for those of you who might not have a child in treatment, I hope some of the principles were helpful. I'll be back next week, March 16th at 6:30 p.m. Like I said, feel free to share those specific broadcasts, the ones where I do question and answer, with anybody in your close circle that you think would benefit from attending and listening and asking questions. Happy to have them on. That's one of the ones that you can share. So I look forward to that next week, March 16th at 6:30 p.m. Mountain Time. Have a great week, folks. Thank you for joining me. I hope this is a helpful point of contact. And for and on behalf of the child and the people that love you, thanks for being willing to tune in and to do your work. Take care. Talk to you next time. Bye-bye.